Welcome back, everyone, to the deep dive. Today, we're really getting into something substantial, a book that aims to be, well, pretty much the definitive guide for clinical lab management. The source we're tackling is Clinical Laboratory Management, a comprehensive review, the third edition. It's edited by Lynn S. Garcia and her colleagues. And when I say substantial, I mean it's, 816 pages, a proper beast of a manual. So our mission today is basically to crack this thing open and pull out the most important, the most useful bits for you so you can get a solid handle on lab management pretty quickly without needing to digest every single page.
Yeah, exactly. Yeah. And that's why this is, I think, so relevant for many of you listening. Whether you're, already a lab manager dealing with the daily grind, or maybe a director thinking about the future, or even if you're a student just starting out in lab science, it really hits home. And what's particularly interesting about this new edition, I think, is how it looks ahead. It's got new sections specifically on lessons learned from COVID-19 and, broader pandemic response stuff, which is, well, it's super important for labs right now.
Okay, right. So it's not just theory, it's meant to be practical. You said it offers deep, actionable content. Can you give us an example? What kind of useful bits are we actually talking about here?
Absolutely. Think about something fundamental like budgeting and financial reimbursements. This book doesn't just list the facts. It makes a really strong case for strategic budgeting. It pushes labs to kind of shift from seeing themselves as just a cost center to more of a value center. It shows how managing money well actually links directly to better patient care. It even provides specific metrics and ways to frame arguments for getting the resources you need. That's honestly really helpful for managers trying to, boost their lab's profile in the hospital.
That's a great point. Yeah, changing that mindset is definitely key. How does it handle the other side, like the soft skills? Leadership, quality management, that kind of thing.
Right. Well, for leadership, it goes beyond just, be ethical. It actually gets into practical situations. For example, it lays out this really effective way to handle conflicts. It focuses on sorting out disagreements with clear steps and measurable results. Uses real lab examples too. And for quality management, it has detailed checklists, performance review forms, things you can literally take and adapt for your own lab. It shows you how to do continuous improvement, not just why. It's really built for, immediate use.
Okay. That detail sounds incredibly valuable, but I keep coming back to the size, 816 pages. Does all that depth make it maybe, I don't know, difficult to use sometimes? Is there a downside?
Oh, yeah, they're handy. Definitely. While the depth is amazing, especially, like you said, in the regulatory chapters, they are thorough, that same density. It can make it hard to quickly find what you need or just absorb it all easily. It's not light reading if you're just looking for a quick answer. The sheer size and sometimes the way it jumps between general ideas and very technical details, it can feel a bit overwhelming.
Right. So it's not really a book you curl up with and read cover to cover then. Who is it really for, ideally? And how should they approach it?
Exactly. It works best as a reference manual you keep on hand. It's perfect for, say, lab managers, directors, current or aspiring ones, pathology residents too. Lab science students who are serious about management would get a lot out of it. Even hospital administrators or consultants needing specific lab business info. The best approach is probably chapter by chapter. Dip in when you need it. If you're working on a new policy or doing the budget or checking compliance or trying to improve your leadership approach, go to that specific section.
Okay, gotcha. So wrapping things up, what's our final take on this third edition of Clinical Laboratory Management? It sounds like overall it's a really authoritative, practical resource. Excels in being comprehensive and useful, giving you real tools for the job, a must-have maybe for the right person.
Absolutely. And the reviews reflect that. It gets, consistently good ratings, around 4.1, 4.2 out of 5. People call it a must-have, excellent, superb.
Mm-hmm.
The main downsides, like we talked about, are just how dense it is in parts, particularly regulations and, the overall size. It's a commitment.
So thinking about you, the listener, this deep dive suggests it's fantastic if you need that deep functional toolkit for your lab. But maybe, as some readers point out, if you want something quicker on, say, the soft skills side of management, or maybe navigating one specific regulation, you might want to pair it with something else, like a focused leadership workbook or a specific handbook.
Yeah, that's a good point. And this whole discussion, it kind of highlights something broader, doesn't it? How even really comprehensive expert resources like this one can be even better when you combine them with other ways of learning. It kind of makes you think,
Yeah.
With so much information out there, how do we best mix things up? Dense books, quick deep dives like this one, maybe workshops. How do we combine learning styles to really get the most out of everything?